We all know today is World No Tobacco Day, and this is 2020. We are sitting in this COVID era. We will briefly walk through some of the important side effects and adverse effects which we can have with the tobacco consumption. This will be followed by the introduction of the symptoms, the type of diagnostic procedures which we perform, and the treatment available for lung cancer briefly. So, tobacco is basically a weapon of mass destruction. Uh, each year, approximately 5 million deaths they are attributed to tobacco. So we basically pay from our pocket to these companies to kill us. This is how bad the tobacco is. So it is a biggest killer ever, I think. It kills approximately 5 million people each year worldwide. And approximately 1 million people are killed in India, which is basically attributed to either smoked or chewed tobacco. So it causes more than 25 different type of disease. We will be briefly discussing these. And the cost of tobacco usage around the world is approximately 45,000 crore rupees. So this is the impact of tobacco which we have in our life. So today is World No Tobacco Day, and the theme for this year is protecting youth from industry manipulation and preventing them from nicotine and tobacco usage. So what is the problem? Smoking it basically damages nearly every cell of your body. It can cause cancers. It can cause chronic obstructive lung disease, which leads to decreased oxygenation in our body. It can lead to heart diseases, cardiovascular diseases, GI diseases, reproductive diseases, and some of the eye disorders. We will briefly talk about these one by one. So, tobacco is associated with increased risk of peptic ulcers and coronary artery disease. Coronary artery disease basically refers to the cardiovascular diseases, heart attacks, and strokes, etc. So, compared to people who have never smoked, smokers they have threefold increased risk of heart attack. Even those with relatively low level of exposure of 8 to 10 cigarettes a day, they have doubled the risk of their heart attack. So each cigarette smoked per day increases the risk by 5 to 6% of having a heart attack. Uh, we think that the only smoked tobacco is a risk factor for heart attack, but it is not like that. So chewing tobacco is also associated with increased risk of heart attack, approximately two folds, but not as high as that of the smoked tobacco, but still it is twofold. So this is what it can cause to your gums. So it can cause dental problems. There are more sites with deeper pockets. There is a greater level of clinical bone loss in the mandible and jaw. So a higher prevalence of the different kind of lesions, then destruction of teeth, and smoking it marks the important clinical symptoms such as periodontitis, and the patients they reach later to the doctors. So this is a comparison between a non-smoker and a smoker's oral cavity. See how bad the smoker's oral cavity is as compared to non-smoker. So tobacco, it can impair fertility both in males and females. So tobacco can make the patient impotent. The cigarette may cause sexual impotence due to decreased blood flow, and this can prevent from having a normal reproductive life. So it has been seen in some studies that those who chew or smoke cigarettes, chew tobacco or smoke tobacco, they have approximately 14% lesser 14% of these people they have lesser number of sperms in their semen. So only thing which get hard is the arteries and nothing else when we smoke or have a chewed or smoked tobacco. So it causes hair loss as well. It might be a surprise to you, but yes, it causes hair loss. So carbon monoxide, which is basically inhaled from the cigarette, it replaces oxygen, which causes the deficiency of oxygen in whole body. And when it comes to hair, carbon dioxide slows down the hair growth instead of vitalizing it, as the oxygen does. So it can cause heart attack, basically caused by tar in tobacco, causing the damage to the blood vessels of the heart. It can cause strokes and brain damage. This is on the right hand side. You can see how a bad stroke is and how the stroke looked like. While at the left hand side, we can see a normal brain picture. This is cross section of the brain when the stroke happens. So tar in the tobacco can cause damage to the brain because of the blood vessels damage. This is how the foot and leg ulcers look like. Some of the patients, some of the people who smoke chronically, they have peripheral vascular disease. So these are the arteries and veins of a person which get small and they get choked, causing these types of ulcers in lower limbs. It also leads to the bone loss. So left side of the panel we can see a normal bone, and right side of the panel we can see a bone which is due to the smoking leading to the osteoporosis. So it causes bone loss, it causes early aging of the bone, osteoporosis, and early fracture with even with a trivial trauma in the old ages. So not alone this, the females also they can have problem during their pregnancy. Those who smoke or chew. So when this woman smokes, the amount of oxygen which reaches baby's brain is approximately cut down to 1/3. So when the baby is born to a pregnant smoker mother, the baby brain is already hardwired for nicotine addiction because of the nicotine that passes across the placenta into the baby's brain. So it is very utmost important that the person who is pregnant should not smoke, should not chew tobacco, and even these people they are at risk from the secondhand smoke. Even if somebody is smoking in a room in which the pregnant female lives, it causes a damage to her baby as well. So this is what a tobacco smoke or tobacco smoke can cause to our infants. They can cause early ear infections, middle ear effusions, then there can damage to the immune system, then increased infection in the child's mouth, then loss of hearing, and child is unable to pick up the sounds from the background. The child can have DNA damage, they can have sleeping disorders, and they can have decreased lung function. This decreased lung function which they acquire in their childhood time, it will last long. So it can last for even for their lifetime. So it can happen because of the second-hand smoke. Even when the child is not smoking, but mother or father they are smoking, it can cause these types of problems in our infants and children. This is a term which is called a sudden infant death syndrome. Uh, this is the sudden death of an infant which is a healthy. So tobacco usage, both direct as well as second-hand smoke, is one of the leading cause of the sudden infant death syndrome. So you have to be cautious if you have a small baby at your home, and less than 6 months of the age is a minimum time period when these infants they have this type of syndrome. 1 in 10 deaths of the infant under age of 1 year they are attributable to these tobacco related problems. So tobacco use in the home doubles the risk of SID. So we have to be very careful if we have a pregnant female at home or we have a baby at home. So this has to be taken care of. So smoke from a lit cigarette, it contains some of the toxic substances like benzene, and secondhand smoke can cause all these troubles. Apart from this, it increases the risk of asthma in our babies. So one of the common cause of asthma in children in the world is exposure to tobacco smoke, and possibly the high rates of childhood cancers such as childhood leukemias, lymphomas, and brain tumors. They are attributable to secondhand smoke, even though the baby is not smoking. So these are few of the known poisons which are seen in secondhand smoke. So smoke, basically tobacco smoke, it has close to more than 60 different chemicals which have been termed as mutagenic and which can lead to cancer. Some of them they are arsenic, formaldehyde, then mercury, vinyl chloride, lead, hydrogen cyanide. So scientists around the world they agree that only safe level of exposure to second-hand smoke is no exposure at all. So basically, we have to have zero tolerance with the tobacco. There is something called as third hand smoke as well. Uh, Most of the people they don't know about it, but yes, it is present around us. So third hand smoke is the particles and the gases which are given off by cigarette that clinch to wall, clothes, hairs, and skins. So up to 90% of the nicotine in the cigarette smoke it sticks to nearby surfaces. So basically, same chemicals they can be swallowed, inhaled, absorbed through the skin of a non-smoker person. So children they are basically at greater risk because they breathe faster than adult and they tend to inhale more chemicals. They cannot take care of themselves. Adult may also be exposed to significant smoke residue if they rent their cars, hotel rooms, or apartments that have soaked up years worth of smoke. So we have this has to be kept in mind that there is something called as third hand smoke as well, which can clinch to walls and clothes for some years as well. So this was basically about these slides are basically about the side effects or adverse effects with smoking and tobacco chewing, which are not cancerous, although these are very important. Some of the next slides we will discuss about cancer because I am a cancer specialist. So definitely I will discuss something about tobacco and cancer. So this is how the healthy lung look like in left hand panel. They are pink, they expand, while on the right hand panel you can see the lung which is full of tar, full of smoke, and this is a diseased lung basically. This occurs after the years of smoking. On the right hand side panel you can see a patient having uh, lung cancer on the right hand side panel, and the left hand side panel as well. So the right side of the lung is normal lung, and the right side of the patient it has a cancer. So 1 in 10 men who smoke will develop lung cancer, and 1 in 5 women who smoke they develop lung cancer. Cigarette smoking, 85% of the lung cancer they are associated with smoking. 80% of the lung cancer victim they don't see their third birthday, so they die within 3 year time. This is true for those who are having late stage cancer. This is not true for those who have early stage cancers. So tobacco can cause mouth cancer. This is a patient photograph of a patient's tongue having cancer on the right side of the tongue. So this is basically a ulcer, which is a cancerous ulcer. This is a real life photograph of one of my patient who had a oral cavity cancer. Unfortunately, he is no more, but this is how bad it can be sometimes. So life can definitely become very bad if you continue to smoke, continue to chew tobacco. Mm, So it also causes urinary bladder cancer. So almost 10 to 15 different kind of cancers they are attributable to smoking tobacco and chewing tobacco. It can cause food pipe cancer. When patient smokes, basically the smoke goes from mouth, then to lungs. It also goes to windpipe, it goes to food pipe, and then it goes to stomach, and hence the whole of the oral cavity, then the food pipe, then the windpipe, then the stomach. It is exposed to these cancerous agents, and hence everywhere it can cause cancer. So it can cause stomach cancer as well. So these are basically aerodigestive tract cancer, which are caused by smoked tobacco. So, what are the warning signs of the cancer? So, can we predict that we have a cancer? Can we have some symptoms which can tell us that we have a cancer? This is, I think, the most important slide, which everyone of us should see importantly. And the American Cancer Society it uses a word of caution, CAUTION, to help recognize 7 different early signs of cancer. So these signs they are not related just to lung cancer or oral cavity cancer. These are the signs in general for a public to understand that a symptom can be a cancer. So first is change in bladder or bowel habit. So any recent change in bladder or bowel habit that is having frequent urination or constipation or diarrhea, which has been a recent onset, can be a change, can be a sign of cancer, and it has to be taken cautiously. A sore that doesn't heal. So you have a ulcer over your mouth, in your mouth, or any part of the body cavity that is not healing for 15 20 days, say 1 month. So it has to be biopsied and looked seriously. So any unusual bleeding or discharge from any part of the body, any cavity. So you can have sometimes you can have bleeding from the urine. So patient can have bleeding while passing stools, excessive menstrual flow. So sometimes these are the signs. These are subtle signs which can indicate that patient can have cancer. Then thickening or lump in breast, testicles, or elsewhere. So any part of the body you have a lump which is now growing can be a cancer. Indigestion or difficulty in swallowing. So you're eating food and it is not going down your throat. You have any symptoms of obstruction, it can be a sign of cancer. Any obvious change in size, color, shape, or thickness of a wart, mole, or a mouth sore. So sometimes we see that we have a patient who have a nevus or a wart or a mole, and he comes to us, tells us that, doctor, this has suddenly changed its shape, or this has suddenly changed its color. So we have to be very cautious at that point of time. It can be cancer. It can be an early sign of cancer. Any nagging cough or hoarseness of voice. So a cough that is persistent for some say 15 20 days, say month, or any hoarseness of voice. So these are seven signs of cautions which have to be taken into account uh, when we are looking at our patient, and this is just for the general public as well. So C stands for change in bladder or bowel habit. A stands for sore that doesn't heal. U stands for unusual bleeding or discharge. T stands for thickening or a lump in breast, testicles, or elsewhere. I stands for indigestion or difficulty of swallowing. O for obvious change in size, color, shape, thickness of a wart, mole, or mouth ulcer. And N stands for nagging cough or hoarseness of voice. So cancer can happen to you. So when I ask this question to general public, so can cancer happen to you? So they would say no, or I don't want to talk about it. People are afraid by just name of cancer and they just don't want to talk about it. But the reality is this. So what all these celebs they have or had in common. So all these celebs they had cancer. So cancer can strike you anytime and anywhere. So we know that Mr. Irfan Khan just died of a neuroendocrine tumor. Munisha Koirala, she had ovarian cancer. Anurag Basu, he had leukemia. Then Vinod Khanna, he died of urinary bladder cancer. So this is the question whether it can happen to you. Yes, it can happen, and we should talk about it. So anybody can have cancer. Any living person on this earth can have cancer. So we will discuss some slide in the few slides about lung cancer, because today is World Tobacco Day, and the lung cancer is the most common cancer which occurs worldwide because of the smoke tobacco. So earlier, lung cancer was extremely a rare disease. In 1878, the malignant lung tumor represented only 1% of all the cancers that were seen at an autopsy in institute in Germany. By 1918, the percentage has risen to almost 10%, and by 1927, 14% of the lung biopsies they had cancer. So this corresponded with the increased amount of smoking in people. So in 1870s there were no smoking, and then as the smoking increased, the companies they came in and they influenced people. They brought some stars to show that the smoking is, yes, look cools, and the smoking, along with the smoking, the cancers of this lung, it rised. So if we see this table closely, in the whole world, most common cause of cancer is lung cancer. Most common cause of cancer-related death is lung cancer. In India, most common cause is lung plus oral cavity cancer. So oral cavity cancer also stands by the lung cancer in India, but still the most common cause of death in in India is from lung cancer in males. In Delhi, the most common cause of cancer is lung cancer. If we talk about females, worldwide, the most common cause of death is lung cancer. Breast cancer followed by lung cancer. So lung cancer is a major health problem. 70 to 80% of the patients they present as advanced and incurable stage. 90% are smoking related. Only 10% they are non-smokers, which have lung cancer. So 10% of the lung cancers they occur in never smokers. Secondhand smoke is responsible for some of them. 30% increased risk for those who have secondhand smoke, and 2000% risk for smoking if a person is smoking himself. Industrial chemical exposure such as heavy metals, vinyl chloride, etc., is responsible for lung cancer. Then radiation exposure and chronic obstructive lung disease such as COPD and bronchiectasis, they are other risk factor for lung cancer. So a basic classification of lung cancer from the layman point of view, you can just see that lung cancer there are two types: small cell and non-small cell. And non-small cell lung cancers they are further divided into adenocarcinomas, squamous cell carcinomas, and large cell neuroendocrine tumors. So a brief about the presentation, how these patients present. Earlier stages when the cancer is very, very small, they are asymptomatic and you cannot detect whether the patient has cancer or not. So until and unless person undergoes some CT scan or some PET scan kind of thing, we cannot know patient has cancer or not. So if endobronchial mass is present, endobronchial means a mass which is present in the airway. So if the airway mass is present, the patient can have blood in sputum, which is called as hemopsis. Person can have persistent cough, which can be dry or productive. Then smoking history has to be very important, which clearly points towards the uh, lung cancer in these patients. Clinically, if you go to doctor and ask, just examine me clinically and tell me whether I have a lung cancer, nobody can tell if it is an earlier stage cancer. So as the cancer grows by, basically it grows locally and then advances to different organs. So as it grows, person can have cough, then breathlessness, which is due to the reduced lung function, obstruction of the airway causing collapse and consolidation, then invasion of local recurrent laryngeal nerve leading to hoarseness of voice. It can invade food pipe, that is esophagus. So because the esophagus is just present behind the trachea, so it can invade esophagus leading to dysphagia, that is problem with eating, deglutition. It can invade chest wall. If there is a chest wall invasion, patient will have severe pain. Sometimes patient can have water in the lung, so which is called as pleural effusion. So this is how we do it. First step is usually a chest X-ray. Second step in diagnosis is a need for a CT scan or a PET scan, and third step is a biopsy. And biopsy, this is mandatory for the diagnosis of lung cancer. In fact, all the cancers, almost all the cancer, 99% cancers, they need to have a biopsy to be proven, and then only the treatment can be started. So it is a myth. So people have different myth that if we do a biopsy, then the cancer will spread. Uh, it is not true. Without doing a biopsy, without doing a PET scan, nobody can treat you. So this has to be made sure that patient undergoes a biopsy, followed by some of the latest molecular testing, and then the treatment can be done. So 1 to 3 stage, the treatment starts with a staging investigation. Staging investigation, we need to have a PET scan. For 1 to 3 stages, it is called as non-metastatic disease. So non-metastatic disease. So stage 1 to 3, they are curable if the proper treatment is given. So this is very important. That is why the early detection and coming to doctor is very important. So most of the patient, they will require 2 or more modalities of treatment. So some of the patients, they would receive surgery and chemotherapy. Some of the patients, they would receive surgery and radiation. Some of the patients, they would receive surgery, radiation, and chemotherapy. But this is the stage 1 to 3 stage, which is a curable stage. So stage 1, almost 90% of the patient, they will be cured. Stage 2, almost 65% of the patient, they will be cured. Stage 3, 25% of the patient they will be cured. So these patients, they are cured of cancer for life. Remember. So stage 4, once the patient comes to us in stage 4, it is an incurable disease. So this is how we treat it. We do a biopsy. Either it is a small cell or non-small cell. Small cell lung cancer, it receives chemotherapy. Non-small cell lung cancer, we do different mutation testing, molecular testing, and then we do a targeted therapy for these patients. So this is how a targeted therapy look like. It is just a tablet. So people have fear in mind that we will have a treatment for cancer and it is a very painful treatment. It is not like that. The death from cancer is very painful, not the treatment. So if you treat, we have a good quality of life. So this is the difference between the targeted therapy and a chemotherapy. So chemotherapy, it generally works by damaging all the rapidly dividing cells, and it will kill all the cells, whether they are healthy cells or whether they are tumor cells. While the targeted therapy, the scientists, they find the specific pathway which are unique to the cancer cells and they're absent in normal cells. So once these pathways are seen, and these pathways are then targeted, and this is called as targeted treatment. And this is also called as personalized treatment, which is a treatment which is personalized for a single person. These have lesser side effect and these are generally milder. This is a talk of the town today. So we have a immunotherapy. So this is a treatment which we have in our arsenal just from last 2 to 3 years. So basically, immunotherapy, it activates the one's on immune system against cancer. So we give some treatment and then it activates T cells and B cells, and these cells, they are activated against tumor cells. They will just kill the cancer cell. So they have lesser side effects, and the post treatment protection is for long. But traditional treatments such as chemotherapy, they have more side effects, and post treatment protection is generally less. Stage 4, today, even in stage 4 lung cancer, some of the patients with targetable mutation, they are treated with targeted therapy or immunotherapy, and they live for 4 to 5 years with a very good quality of life and a meaningful survival. So 20 years back, this time period was just 3 to 6 months. So we can see huge difference between between the survival time of the stage 4 lung cancer as well. Hence, we have made a considerable progress in our treatment, and giving a patient quality life is also very important. So we should never give up, even if it is a stage 4 cancer. I have shown you that those patients who have targetable mutations, they can survive for 4 to 5 years. This is true for all the cancers. So almost all the patients who have different kind of cancer, they will have some amount of targetable treatment available, and these people can live for a longer period of time. So this is the last slide of today. So benefit of quitting tobacco. So within 8 years, 8 months, sorry, 8 hours, the carbon monoxide levels drops. Within 3 days, breathing becomes easier. Within 6 months, cough, stuffy nose, tiredness is gone. Within 1 year, the risk of heart attack is cut by half. Within 10 years, the risk of lung cancer is cut by half. So within 15 year, risk of heart attack is same as a person who have never smoked. So the risk of heart attack doesn't get lowered if you are a very heavy smoker. But if you are a light smoker, this also risk goes down. So but the risk of having a cancer or a heart attack goes down only when you have quit smoking for at least 10 to 15 years. Thank you so much. This was my presentation. The floor is open for any type of question and answers. Thank you. So
Thank you
please,
so
over
much,
to you.
sir. Yes, sir. Thank you so much, sir, for this presentation. We have some queries in chat box, sir.
Mhm.
So first query is by Irfan. He says that he's an avid smoker, at least one box in a day, and he has tried quitting time and again using e-smoke or nicotine gum, but he always fails. So, sir, even I wanted to know about this. The concept of vaping is not new in this world. So many people are trying to switch to vaping from smoking, from using a tobacco. So,
See,
so how safe is vaping
vaping
compared
vaping
to?
vaping is not safe. So it has been
Hmm.
clearly said by WHO and FDA that vaping is definitely not safe.
Mm-hmm.
E-cigarettes, they are not safe. So any kind of smoke, any kind of vaping is not safe. And as regard the quitting the smoking, the most important thing is a determination. Nothing is before determination. So I understand, and many people, they have failed attempts before they quit smoking. I think Irfan has not taken any kind of medicine for smoking apart from nicotine gums and all. These people, they need to have some amount of counseling sessions as well. Cognitive behavioral therapy is one of the important thing which can help. Some of the drugs, they are also available for this treatment. Varinocycline is one of them. Another is bupropion. But these, they have to be taken under the guidance of a doctor. They have to be taken under the guidance of a person who is dealing with these type of cases, right? So smoking, most important thing is determination. You have to have a good community around you. For example, if you're living some people who are eating daily and daily, they're not worried about their exercise and their body. So definitely you will also become obese one day, and you will also keep on eating. If you're living with 10 people who exercise daily, who take care of their body, who don't eat much, who don't drink much, you yourself will become thin and lean, and become okay. So the community is very important in these cases. So it has to be determination and some support by the doctors.
So Suraj Sharma also has a similar question. Does e-vapes have some negative effects as cigarettes?
Sure. I have already answered this. E-vapes are also not good for health.
Yes, sir. And sir, one more question from Patna Dairies. How current COVID situation is impacting the affected lungs?
So, COVID is really bad if it comes to older age people, and those people who are having a pre-morbid condition such as cancer or diabetes or heart disease. But if it is coming to young people, they're pretty asymptomatic. And those people who are smoking, mind you, those people who smoke, they can have some very bad experience with COVID. uh,
Okay.
Most important is to protect your elderlies. They are at risk. Young people, they are also at risk, but the mortality is very less in our country at this moment. It affects lung very badly. Almost 10% of people, they will require oxygen inhalation, while 2% or 1% of the people, they would require ventilation, mechanical ventilation. As per WHO report, 2 to 3% mortality is there. I mean, 2% or 3% people, they will die of COVID, but the cure rate is decreasing. We are expecting a vaccine in October or November probably. We are expecting some good antiviral drug as well, but you don't have to be panic. You have to take care of yours and elderlies. You have to take precautions.
Yes, sir. So do we have any more questions?
So there are few questions. Sir. Eating sugar causes cancer to grow. Is that a myth or true?
So, when it comes to cancer, you have different opinion. You have some opinion on WhatsApp. You have some opinions on Facebook. Uh, there is no clear-cut surety that sugar increases the risk of cancer growth. Uh, there are some of the papers which are for and against this. So there is no sure answer to this. But definitely, as far as our experience is concerned, we don't stop sugars for those patients who have cancer.
So I had one more question, sir.
Hmm.
Suppose there is a family near my place. The whole family is COVID positive.
Hmm.
Okay, so I have my grandmother at my place, and my father is 53, 54.
Mm-hmm.
So, and he has had many lung infections in the past.
Mm-hmm.
So, he is at a greater risk of acquiring COVID-19, right?
So, if you're asking about acquiring COVID-19, so acquiring COVID-19 would, it will not come to you unless you go out and bring it to you, right? So they have
Hmm.
to be they have to be locked inside you. So they have to be isolated. So acquiring COVID is not a problem. So if you don't go outside, if they don't go outside, obviously they will not acquire that. But yes, if they acquire,
Hmm.
the results can be bad for your grandmother and those people who are having a comorbid condition.
With
See,
conditions. Hmm.
we don't have any definite answer to this. We have seen that 80-year person surviving COVID. We have seen 65-year person COVID surviving. We have seen cancer patients surviving COVID. So there is no definite answer to this. But yes, what we have identified is that those who are aged, those who have multiple comorbid conditions, they definitely have to be protected. They have to be protected.
Okay, so
So, Preet, one more question came from Priyanath. How does passive smoking affect you?
So, passive smoking we have already discussed in these previous slides. There are few of them. So we had talked about third hand smoke. We had talked about second hand smoke. Uh, we had talked about this. So this is third hand smoke. We talked about this. These are the some of the smoked particles and gases which get clinched to the wall, clothes, and all these things, and they can persist there for quite some time. And if you inhale these, or some of the children, they come in contact with those. They have oral inhalation or something like that. They are at risk, and this is what we had talked about second-hand smoke. So if you have a baby at home, you're smoking, they can have increased number of uh, ear infections, then problem with the immune system, increased loss of hearing, sleep disorder, decreased lung function. And there was another slide which I told you. Those who have a second-hand smoke, they can have more than 5%, 5 times risk of having lung cancer.
okay, sir. So there's one more question by Irfan. He says that what about weed? How they impact?
See, weed, so well, I'm not very sure, but if you're taking it, well, I will not say on that platform that you should take weed, right? But personally, I can say that if you're taking it once in 6 months or once in a year, it will not increase your chances of lung cancer. But I don't promote that.
And there is one more question, sir. A lump in your breast is always the breast cancer. Is that a
Sorry,
true or is it myth? A lump in a breast is always the breast cancer.
Rajiv, I am not able to hear you.
Yes, sir. So there is a question that a lump in your breast is always the breast cancer. So is that
No,
true
no,
or is that
no,
myth?
no. It's not like that. So the young females who have lump, basically, most of them, they are not cancer. So lump in a breast in a young female is cancer in approximately 10% of the time. 90% of the times they are not cancer. But a lump in a 60-year-old female, or lump in a 40-year-old female, the chances of being a cancer is more. So it is always advisable that the females, they should know how their breast looks and feels like, and if they find that there is any abnormal thing with their breast, they should immediately report to their doctor. Breast cancer is one of the cancer which is highly curable. So even in stage 4, people, they live for 10 years. So please don't ignore breast cancer. We have made a huge amount of progress in breast cancer. There are some screening protocols as well. So if you have a family history of breast cancer, your mom had a breast cancer, or your distant relative had a breast cancer, we have a screening protocol for these kind of normal people. So you have to do a yearly breast examination and a mammography for them. So it is not like that the breast lump is always a cancer. So some of the children of 15 year or 20 years, they come to us and it is not a breast cancer. But as the age increases, the chances of having a cancer is more.
Thank you.
Any other questions from the group? So I don't think there are any other questions, sir. So, sir, on behalf of Intas Oncology and Head Start community, I would like to thank you for taking out time on a Sunday for giving this session. And now everybody knows what they can do to quit smoking and what are the signs and symptoms that can lead to cancer, lung cancer specifically. So, thank you so much for joining in
So
today, sir.
thank you for inviting me.